in between meetings. So my actually today, y'all not gonna hear so much from me today. Veronica is gonna be doing a lot of the facilitation. I just wanted to open up the meeting. Thank you all for being here. Certainly want to give you guys an update, really quick update on where we are in the EHR. We had a meeting this week with uh, many of our districts, about 15, 16 of our districts this Monday or Tuesday, and we were able to develop some characteristic or identify some characteristics of the EHR. And we also were able to get our and I'll tell you guys, yes, please sign in, y'all. Sign in, use the QR code to sign in, and we also put the link inside of the chat. But we were able to identify some representatives who are going to be a part of the evaluation process for the EHR. And so we appreciate Rialto, Upland, and Dr. Sosa from San Bernardino County Superintendent of Schools. Student Service Branch is going to be supporting us as well. But we're also going to be utilizing those 15 districts who were in that conversation to continue to lead this work and support the EHR aspect of it. The other thing about the EHR is we did get the proposals closed today. We had 6 different vendors who put bids in. And so I won't give y'all who they are yet, but we had 6 of those. So the process of that is really going to start now. It's really beginning now. We'll start evaluating, and we will get to the presentations and the interviews by April 3rd. So we'll know deeper, we'll know some more details early April, okay? But please sign in. And today we're really gonna be focusing on just best practices around receiving or getting the documentation for our districts. I mean, our students, right? I'm always in that mindset. Oh, look, the team telling me where to say. Please remember the meeting guidelines. Thank you, guys. Remember the meeting guidelines, utilizing the chat. Also, staying muted, and utilizing the raise your hand feature to indicate that you'd like to say something. Okay, so sorry, I'm going ahead of everyone. Other than that, I'm gonna pass it to Veronica. Go ahead, take over the agenda and everything else. Go ahead, Ms. McClendon. You got it.
Good afternoon, everyone. I'm actually going to turn it over to Karen. She has a fun activity for us this afternoon.
Hi, everybody. Welcome. So I'm Karen Delatorre. I'm one of the community health system specialists here at Healthy SBCSS. So I like fun and I like laughing and I like to open things up for conversation. So we have a fun icebreaker or a connection activity. Jameen, can you turn it to the next slide, please? So I just want you to sit back, watch this video, and then we're going to talk about and have some questions surrounding it. So get ready. It's funny.
That's not good.
Oh, I don't need this. I'm already late.
Somebody will come. Anybody out there?
Do you have a phone?
No. Sorry. Somebody! Hello? There are 2 people stuck on an escalator and we need help. Now, would somebody please do something? I don't believe this. You gotta be kidding me.
I'm gonna cry.
Well, there's nothing else left to do, is it?
Hello? Hey, don't worry about it. I'll fix it in a second.
You said you could fix it. All right. All right, that's more like it. He says he can fix it.
Walking down the sidewalk, kicking my feet as I'm moving to the music. Step to the beat, I woke up today, canceled all my plans, and I stepped right outside with my guitar in my hands, and the notes became loud as the sound caressed the air, and I kicked it up a notch as I strolled without a care, 'cause I'm going down the road to a brand new place, and I'll get there with a smile.
Thank you, Jimmy. So I hope you guys enjoyed that. And like it says, most problems are easy to solve. Just get off the escalator, right? And so oftentimes I go, that's our team, the people to come and repair, but then we got stuck on the escalator too. And they're like, oh man. So I wanted to ask these questions about feeling stuck because we're in the thick of things, and sometimes we get to getting our work done and we're like, yes, we're going to do this, and then we get stuck on the escalator instead of saying, why aren't we just taking that step forward to get off of the escalator? So I want you to ponder these ideas. Feel free to mute, feel free to answer the questions in the chat, but think about this. Do you feel stuck on the escalator when it comes to CYBHI? We throw that conversation out a lot. We throw that acronym out a lot, right? And what specific challenges are making it difficult to get off the escalator if you feel stuck on the escalator? What does it look like to get off of the escalator? What does it look like to take that first step? Maybe you've taken that step already and given people the idea like, hey, you just got to put one foot in front of the other or walk the other way to get off the escalator. So these are things to think about. So any thoughts, ideas? You can feel free to unmute, feel free to get in the chat, whatever you need to. Oh, Elizabeth, I see you.
Yeah, I at times I feel like I'm stuck, but I'm just an office assistant. So the higher ups are the ones that are really making the calls on different things. So all I can do is present them with the options and inform them of what I'm learning. But in the end, I have to wait for them to come up with a decision or, to send me certain information. And that can be frustrating at times.
Yeah, so it makes you feel stuck. You're not just an office assistant. You make the whole thing go around and around. Thank you for sharing, Elizabeth. I appreciate that. Anybody else? Thoughts or ideas? What do you guys think about the video? It at least made you smile a little. I see, Linda. We just keep moving forward, even if we end up on the roof. It was great. Anybody else want to share? I know you guys talk. I know you guys talk a lot. Anything else? So these are things to consider, right? Think about community partners who can help you take a step forward. There's lots of amazing community partners that might be able to walk beside you and help you get unstuck. There's us here at SBCSS. We can walk right beside you to help you through that process too. Think about what resources or partnerships do you still need? What's missing? What do you need to help you get unstuck? What tool do you need to help you get off the escalator, right? And then how are you going to measure those successes? You're all taking step forward. You're here. That's a step forward in the right direction. So looking at that progress that you've made, celebrate the progress that you've made, and then continue. And you might end up on the roof, and then we'll just have a roof party. I like those rooftop parties. So we're all in this together. So if you're feeling stuck on an escalator, we'll take the step forward, or we'll get you the tools you need so you can get off that escalator. So I'll put the link to this video in the live binder too, so you can access it and you can share it with your team. So like Elizabeth, when you have those meetings, you can show this escalator video and you can say, let's not get stuck. I need an answer to this right now. So so that you can make those steps forward. So thank you so much for joining, and we're happy to see you here.
I've got a comment.
Oh, yes, Getty.
Yeah, in thinking of our case, stuck can also be being stuck where there's gaps. You don't have what the next process is maybe, and you're having to go find out. And instead of there being the continued tread of the escalator, you now have these big gaps that you have to make a big step from one step to a gap to the next step. So for us, it's as a agency that's sort of coming into the process, we have to negotiate those gaps and really try to find out what we need and get support and get help and come to webinars like this so that we can bridge those gaps. So thank you for being out there.
Yeah, I appreciate that comment. And sometimes you have to be stuck to realize what gaps are needed, right? You have to get stuck to say, okay, this is a barrier that we didn't even know we needed. And then who can we use or what do we need to get over this gap? So I appreciate that comment. Thank you, Geddes. Anybody else have anything to share?
Karen, thank you for engaging us in that activity. And in order to continue our discussion about collaboration, how we can work together to go full circle with the fee schedule, make sure that we're able to provide the services and sustain the services, we are going to have or facilitate some breakout sessions where we're going to share information about the CYBHI messaging that you can use in your school, in your district. And we're also going to talk about some resources and provide you guys with some resources. So Jameen, if you can put us in breakout sessions, there you go. And these are the questions we're going to answer. I think she's doing it now. While she's working on the breakout sessions, the rooms, I did put the questions in chat. And the specialists also have the questions, so they'll be joining the breakout rooms. All right. So in the spirit of collaboration, what ideas were shared that you found useful so that we can try to come together and implement those in your LEAs? What messages, what strategies?
So, Veronica, I know in our group, what we began to we were in conversation before we got cut off with just the importance of not so much just the strategies and the how of getting this information, but also like the deeper issue of really the messaging around the trust that's going to be needed to do this, right? The trust that's going to be between our parents, our boards, all these folks, for them to actually be willing to engage in this, right? And so we wanted to, we were discussing the how are people navigating the political impact of this of this work, right? So that when we do deploy these different strategies, they actually are received and families are engaging, right? Families are engaging with these strategies because they trust the process. And so on top of your question, was there any, from the other discussion, any conversation around the political impact of this in your districts with your boards and your communities?
So I'll share. Here in Upland, we are having some tough conversations around budgets, about cuts, and some of those cuts are going to include positions and people. And so as our superintendent visited all sites and had some budget discussion meetings with them where she kind of shared the plan and the vision of what's kind of coming down the road with these budget cuts, one of the things that she was able to highlight was CYBHI and the potential that it has to create revenue for our district. That we already have a lot of these systems and services in place, and that through CYBHI we'll actually be able to get reimbursed for them. And those funds go, they're unrestricted funds, so they can really be spent anywhere to support the shortcomings that we're feeling right now with the state budget. So there's a lot of awareness at all levels about why this is an important initiative.
Wow. And that so your superintendent is actually messaging this with the district.
Yes.
Yeah. That's key.
Yeah.
Any other thoughts? Yeah, that's
I just
great.
wanted to reinforce that. I think a lot of LEAs that we have met with, we've really been trying to encourage and reinforce them to get their executive leadership team involved, because that's who's going to really start pushing out the fee schedule and get behind and support this whole initiative. So I think that's super, super important. And hopefully most of you have already started informing your executive leadership about the capacity grant and the fee schedule.
Yeah, absolutely. And again, we know kind of what Elizabeth was talking about, right? Many times we have people who are doing the work, right? And waiting on decisions. And so really getting those folks involved is going to be key in the success of this. And when we always are looking at, you guys know, I always talk about the importance of this capacity grant money, this seed money, especially for some of the districts got a lot more money. Like this opportunity, we can't what they say, we can't drop the bag, right? Like we got to literally make sure that we are able to make things happen with this seed money, right? Because we may not get to see this again for another couple of years, an opportunity like this. Other thoughts?
You certainly want to create a program that is going to be sustainable, and this is the opportunity to use that money in a way that you can sustain the services.
Mm-hmm. Okay, Veronica, go ahead. I'm sorry. I know I wanted to bring that.
No, that's good. We can, Jameen, can we go on to the next slide? Thank you. So I know Karen has been our advocate and has been working very closely with Bright Life Kids and Saluna. So we again wanted to just highlight that these are opportunities for your schools to connect with these agencies that are also funded through the CYBHI grant. And this last point, the CYBHI fee schedule, I know this information has been sent out to you all, and we've also put it in the live binder, but DHCS now has some brochures and flyers on the CYBHI information. So your districts can certainly start using that to inform the community. Next slide, please. There's been a lot of information coming out through the media. I've seen TV commercials on Never a Bother, Bright Life Kids, Saluna, CYBHI. I've heard radio advertisements. I know there's a billboard up in San Bernardino highlighting CYBHI. So we also wanted to share that with you, that this is also some messaging that you can get out to your parents, teachers, in order to inform them about the CYBHI. Have any of you all seen videos, heard the advertisements on radio, seen billboards? No? I guess it's just the behavioral health team that's
You know what?
that's hearing it.
Yeah, no, I've seen the Bright Life ads, so that's connected in Solana.
Mhm.
Yeah, there's been a lot of, especially those apps have been out there a lot.
Yeah.
The ones that you just mentioned on the last slide.
Okay, thank you. And also, Dr. Sohail Sood from HSS, Health and Human Services, he has a 10-minute YouTube video out educating us about the fee schedule. So we've attached this to the slides, which you'll get at the, by the end of the day. I know Karen's our live binder queen, so she'll make sure that's to you all. Next slide, please.
And a quick comment,
Go ahead.
or question, are you wanting us to put this up to really promote this on our websites?
We're just sharing information with you all so that if you choose to use it, you can use it and share it at your LEA. And we're giving you, that's why we're having this community of practice to kind of talk about different things that you can do within your school to promote the fee schedule, to help reduce the stigma, to inform parents, to inform your staff, because those are going to be the people that need to know in order to
Right.
sign those insurance authorization consent forms. Okay, no problem. We also have information about digital and social media. I'm trying to read these. You can add the CYBHI link to your school's website. You can share resources on parent and student portals. I know when we were meeting with Kaiser, they talked about non-Kaiser promotional information that they're sending out through social media. So just using digital creators to promote CYBHI. And it doesn't necessarily come with a Kaiser logo on it. So that can also be something. If you guys have students that are into, digital media stuff, you can get them to start sharing out this information as well. You can include CYBHI messaging for parents and students in newsletters and emails also. Any questions or feedback? No? Okay. Next slide, please. Here's some ideas for on-campus messaging. You can get your students involved. I know we have May coming up, Mental Health Awareness Month. This would be a good opportunity to start getting your students and getting their creative juices flowing so that they can also start incorporating CYBHI and mental health awareness into their activities. You can do it through your mental health services, your wellness club, student council, invite community-based organizations on campus to do some presentations. And I know that messaging, billboard messaging on your, school's system, if there's anything that you guys can do through your PA system, those are just opportunities to start getting this information out in your LEA. Are there any other thoughts that you can add so that others can hear and maybe borrow?
So in Upland, we have a mental health awareness month event every year. So this will be our 4th annual. And we have like a keynote speaker, And then we have a student panel where we have students who have lived experience with mental health supports, and they're able to kind of talk through that. And then we finish up that event with community resource fair. And so we invite community partners. We have CCRT there. We have County Behavioral Health. We have Saluna was there last year. So we have lots of different, about 25 to 30 different community partners that come and share those resources with our community. And we've just had a bigger and bigger turnout every year, and our families look forward to that event.
Thank you, Mario. Anyone else have anything they would like to share? No? Okay, thank you. Next slide, Jameen. So, other schools that we've had opportunity to meet with have talked about using student events, like sporting events, assemblies, Spirit Week, student clubs, art and media to promote mental health awareness and the CYBHI capacity grant. So these are, again, some additional ideas that you can consider in order to get the message out to your students, your parents, teachers. Next slide, please. We have created a few little talking points, and there's some videos and information also added to the live binder. Again, just information informing your teachers, your faculty, other staff members about CYBHI and what the capacity grant can do and how it can support the students. We are even highlighting what SBCSS has to offer, which is our suicide prevention services. So you can always get in contact with your point of contact, and they can connect you with our suicide prevention team so they can come in and provide some support as well. Next slide. And just some more parent engagement information, how to promote this, the fee schedule to your parents, PTA meetings, parent advisory council, community partnerships with local organizations. I highly encourage you to connect with your local mental health agency, DBH contractor. They can certainly help you get this message across. A lot of people indicated they want to develop contracts with organizations. I know DMCC will be providing some CYBHI support. So if you work with them, or if you want to work with them, they are willing to support you in carrying out the capacity grant and providing these services so that you can sustain them within your LEA. All right, next slide, please. All right, Marwa, turn it over to you.
All right, so really the purpose of this section is to start promoting the CYBHI initiative, the messaging to families, to staff, teachers, basically everyone, because once things start to pick up and you guys start getting into the fee schedule and whatnot, you don't want to, simultaneously work on the messaging and do what you guys are currently doing with your implementation plan. So these are some strategies that you can begin implementing at a district level to promote CYBHI and just mental health in general. So I know Mario shared like what they currently do with May Mental Health, so you can leverage that and add the CYBHI messaging as well. But one of the things that we notice other school districts are doing, like LAUSD, is that they're tapping into their family engagement departments, and they're tapping into their leads or their liaison, and they're having conversations regarding CYBHI and the fee schedule. So they're giving them information, letting them know this is what we're currently doing at a district level, and that if you can, communicate this information with your families. So that is one way to do it. You can host parent workshops, you can present or have, you know, the person that is taking the lead on CYBHI at your district present to families or the family engagement department. Another way is tapping into your district communication department or channel. So then that way you can start utilizing Parent Portal to send out the message regarding CYBHI, what it is the fee schedule, the purpose of it, tapping into your social media accounts, newsletters, just to share this information with them. The other thing that we also noticed other schools are doing, other districts, surrounding districts are doing, is that they're sharing the information not just with the district level staff, but also their teachers, because their teachers are usually the ones that are interacting with families, paraeducators, janitors, bus drivers, counselors, basically everyone. So this is also another way of sharing that information. And I know CYBHI can be a little bit complex and you know, overwhelming if you're sharing all that information at once. So just providing just a brief high level information to them, so that way they just understand this is what you guys are currently doing and this is what's coming next. Also integrating the message and resources into like after school activities or sporting events. And then most importantly, collaborating with your community-based organizations that have a very strong connection with families. So a lot of you guys already work with community-based organizations, so just front loading them, giving them that information regarding CYBHI and how they can get involved. I know here at the county office, we work pretty close with a lot of community-based organizations, so we're doing our best to send out that message to them regarding CYBHI and the fee schedule, so they're also well aware and they're providing that information as well to their families. Next slide. So these are some examples, and the links are on the slide, so you can click on them, but these are some examples of how some of the districts are promoting CYBHI on their website. So Fremont Unified School District actually provides a whole FAQ section for their families regarding like, why do you need this information regarding my child? What is the fee schedule? Is it going to charge my health insurance? Common questions that they've heard, so they have it on their website, and just additional resources regarding CYBHI. And the same thing, Monterey is also doing the same exact thing. Palm Springs, though, they actually collaborated with their local newspaper to give this information regarding CYBHI out to the community. So it wasn't just targeting families, but it was just the whole community. So next slide. And these are other examples as well. So you have a couple of examples that you can pull from, but these are just the same exact thing. They have information regarding the fee schedule, common questions that are being asked, the whole child approach, how to address factors regarding mental health, and then linking, you know, information regarding CYBHI. Next slide. So like I mentioned previously, Los Angeles Unified School District, they host parent workshops to explain what CYBHI is to their families, the importance of providing health insurance information, because I think that's a big one. A lot of districts have expressed that it is a barrier getting that information, and also making sure that you offer these workshops obviously in, you know, multiple language or the common language that's spoken within your district. They also use their website, social media, and newsletter to update their families regarding the initiative as well. So, and then we have up north, San Francisco Unified School District. They host webinars and online resources specifically for their families. So this is like an idea where you can tap into your family engagement department, have them host the webinar, and provide that information to families if they can't come in person and whatnot. And then San Francisco is also collaborating with their local health organizations to reach out to families to provide them with this information. So these are some examples of how districts are currently really trying to push out the message regarding CYBHI. I know that for us, for May Mental Health Month, we are going to have a mental health campaign, a countywide mental health campaign here, with collaborating with our community-based organizations and managed care plans to make sure that we are all on the same page and pushing out the same message regarding CYBHI and mental health. So that's coming soon. which you guys will have access to that information as well. So you can be pushing out the same exact message that we're trying to push out countywide. Next slide. Okay, I think I'll pass this back to Veronica.
So this now brings us to the tough discussion. How do we collect student health information? And the reason that we spent quite a bit of time talking about reducing stigma messaging is because informing the people that are going, parents that are going to sign consent forms, consent to bill health insurance, authorization forms, whatever we want to call the form, they need to be informed before we can start asking them, hey, give me your student private insurance or Medi-Cal number so they can participate in a wellness center activity, a small group exercise. So Jameet, next slide, please. So in meeting with, in our meetings with SCOE, and lots of different districts have been represented. These have been some ideas, and I know we do have forms that you will, that will be in the Live Finder that we'll share in a couple slides. But there is information on how you can collect the student health information in, appropriate ways. So, of course, people want to know about confidentiality, right? So we want to make sure that, however, if you're doing it on paper, if you're doing it through your enrollment process, parents are aware that this is, private, Medi-Cal numbers, private insurance policy numbers. But they also need to know why you're collecting this information. So we want to highlight that you're making sure that you're informing the parents that their children have access to behavioral health services, which some of them may be on a waiting list. Sometimes referrals take a long time to be processed, and students may need immediate services. We also want to talk about the benefit. There are benefits for students receiving services at school. They can receive it during an PE class where they're, can maybe miss a class versus missing math or an English class. So services are more accessible. You can also highlight the interagency collaboration if you're doing any type of, I don't know if you want to say outsourcing or working with like a virtual service, you're supporting that interagency collaboration also. Next slide, please. We got 5 minutes. So here's some other ideas about methods for collecting student health information using your enrollment forms, your online portals, student information systems. We've heard, I know that some districts use Aries and there's other student information systems that are being utilized. So you can use that to gather the information. You can collect information at your open house, back to school events. Again, Marwa mentioned school events, sporting events. We've heard field trips, permission slips to participate in like special health education information. You can use it then. Next slide, please. Some additional opportunities, there's parent-teacher conference or IEPs, hosting a health information night or health fair for families, using your wellness center, or if you have a school-based health center. Some districts are working with the community health workers that do field visits. So if you have students that are, having facing chronic absenteeism or having some behavioral issues, maybe you can get your community health worker to do a home visit and they can educate your family about the CYBHI fee schedule. Next slide, please. And here are some examples. I know we're not able to open them, but they are definitely in the Live Finder of different, consent forms, insurance authorization forms that we've been able to obtain from different districts that we're going to share with you all. I know some of you already have your your, I guess, consent form or insurance authorization form. If you are willing to share that, you can certainly send it to us so we can also provide that to the LEAs that are participating in the capacity grant. Next slide. All right. So before we jump to our upcoming events, I just want to see if anyone has any comments, questions that they would like to ask before we jump into this last slide. Anything, James? No? Okay. So here are our upcoming events. We have the Spring Wellness Center Tours, April 9th. And that will be hosted by Colton. So we're very, very excited about that. Expanding Your Wellness Center with a Wellness Coach webinar is April 16th. The Whole Child Collaborative is April 17th. And our High Desert Mental Health Network meeting is, or I guess it's a meeting, it's May 1st. If any of these are activities or events that you would like to join, please reach out to your point of contact so that they can get you the information or the OMS link. Next slide, please. And this will also be in the email. It's the live binder. So all the information we've shared today, all the videos, all the links will be in the live binder. And all you have to do is click on it and you can access it. Next slide. Thank you all for attending, and our next office hours will be April 3rd, and our next community of practice will be May 9th.
And thank you, Rhonda,